There's been recent movement on bringing saliva-based COVID-19 testing to the KC area.
Yeah, both sides of the state line making strides in developing these tests and making them available to you as well.
That's right. Let's get to 41 Action News reporter Dan Cohen joining us live in Lenexa from a local lab that's making a big announcement today about their saliva test. Dan, what's different about this one?
Lindsay, we're going to give you that big announcement right now. We're a clinical reference laboratory in Lenexa. They've been developing a saliva-based COVID-19 test, and we are very happy to be joined by the CEO of Clinical Reference Laboratory, Bob Thompson. Bob, we're going to give you the floor. What's the big announcement from your laboratory this morning?
So today we are announcing our direct-to-consumer saliva test. It's a test for COVID. You just spit in a tube. It's $110. You can get it at order.crlcorp.com. And it's really the first of its kind and the cheapest and most accurate way to test at home.
Can you give us the timeline of turnaround? You spit in the tube at home and then you send it back. What's the turnaround time to learn your result?
So if you order a test on Monday, you'll get it on Tuesday. And if you collect the specimen on yourself on Tuesday, we will get the result back to you on Wednesday or Thursday at the latest.
I know that there are multiple kinds of tests out there for COVID-19. Can you take us through the difference between saliva-based testing versus the nasal swabs that we've been covering for the last few months?
So those big, long, brain-tickling nasal swabs are considered by the CDC to be the most accurate, the gold standard. There's a second kind of test, which is a shorter nasal swab, which most of the rapid tests use. And those tests are not as accurate. They have somewhere, depending on the study, between a 20 and 30% false negative rate. And some of them have some pretty decent percentages of false positives. And then the third kind of test is saliva. And saliva has been proven in many studies, not just our saliva test, but others, to be just as accurate as the long brain tickling swabs.
I know that your lab has put out these saliva tests into the community already. Can you tell us who's been using them? Because you have had some pretty prominent organizations and companies using these saliva-based tests.
Yeah, and that's actually why we developed it, because we were doing tests for some of these companies and universities, and then we had people say, hey, I want to test my wife too, or my kids. And that's why we started to think about direct-to-consumer. But we did testing for the KU kids when they went back to school. We did testing for Emporia State, Fort Hays State, pretty much all the region schools in Kansas, Missouri State as well, and we have a contract with the state of Kansas, the state of Missouri. Every week they're doing testing in Independence, Missouri, and some of the largest banking and financial institutions in Kansas as well. The Kansas City Chiefs are using us to test everybody who is going to be in one of the suites at the games. So you have to get tested within 72 hours of the game itself.
Some major news from Clinical Reference Laboratory in Lenexa. Bob Thompson announcing they will start selling directly to consumers today. Taylor and Lindsay, back to you.
Dan, how fragile are these? Could someone buy one right now just to have at their home in case they ever need it? Or does it need to be bought and used quickly?
We'll clarify that for sure, but it sounds like this is going to start today, and it's that $110 price tag, according to Bob Thompson, who we just spoke to. It's the cheapest available compared to other direct-to-consumer tests that are available. And again, it's that 24 to 48-hour turnaround time, which is a lot faster than we've seen over the last few months.
Dan Cohen reporting live for us this morning. I will say I went to the order.crlcorp.com website that he just mentioned there, and there is a questionnaire that you have to go through to be eligible to order one of these tests. So important that you're able to answer those questions whenever you go to order.crlcorp.com to order your test. Dan Cohen reporting live for us this morning. Dan, thank you very much.